The following is a JourneyWise Network production.
Friends, we want to welcome you to the JourneyWise podcast. I'm Shane Stanford.
Ronnie Kent.
And again, we have with us today Dr. Pokey Stanford, an education specialist, and also Dr. James Kent, counseling psychologist. And we had a great conversation last week, guys, about getting started for the school year and getting prepared for that. What I know a lot of parents out there are thinking of is the particular learning anxiety or situation that my child is in. And that's a spectrum of issues. It may be things that don't require a 504 or an IEP, but there's still real issues for that child going to school and being healthy in that, all the way over to issues that are diagnosed and require some special attention. So let's just jump right in. And do you have a question you want to ask first?
Well, I think just dealing with the thing everybody's going to have a little issue is anxiety.
Yes.
Is the anxiety before school.
Yeah, talk about that.
Well, classically, within diagnosis, you have the anxiety disorders, social anxiety, generalized anxiety, illness anxiety. There's a myriad, separation, OCD. I mean, there are a lot of different ways that it may manifest, but really you can boil them all down to a fear that has something to do in some area with performance or not being able to.
Yeah.
So in a social situation, not being able to say something or be articulate. It could even be not being able to get out of the room you're in. A lot of times that's associated with panic attacks. And so it can manifest in a lot of different ways, but you also just see it in a child, especially just in an initial response or reaction to something. A lot of times we see it as misbehavior when it's actually not misbehavior at all. It's an inability to cope with a situation. And I'll throw out there very quickly, the right response in that moment is to teach. It's not to discipline. It's to come alongside, have the relationship where you can say, hey, I see you, I hear you, and let's work through this together. Because then they walk away with a notch on the belt.
Sure.
Versus a bruise on the hiney.
Yeah, sure.
It's not really going to do
I call it tools in their toolbox.
Yeah.
And our job is to fill that toolbox up.
Yeah.
So when you're talking about, I did not get diagnosed with a particular anxiety disorder until I was in my 40s. But I do remember situations occurring as early as a second grader. After my parents got divorced, we moved to a new community. A friend of mine that I played with, mother passed away, and I had happened to watch a movie about Pearl Harbor. Now, as a 7-year-old, why would you do that? I guess, but and so every time I would hear a plane fly in the sky, I would have this feeling my mother's going to die, and it really, I think back on it, it bothered me for a long time during that time period, and then I filled it with other anxieties as I got older, making a whole plethora. Yes, but that was something that hindered me during my day that had nothing to do with learning, but it did affect learning. So what do you do with this generalized sense of a child who just seems to be more anxious?
Well, I think to know the child first and be able to communicate. The reason we have terrible twos is because our ability to understand language is so much greater than our ability to express language. So what's so terrible about being two is I understand my whole world around me, but I can't tell you anything, so I'll throw a fit. And which is why it's more extreme in some kids and less extreme in others.
Works at 32 too, I've seen, yes.
I wouldn't go there either.
Yeah, don't worry.
But I mean, if you think about it, that's really what we've done to kids sometimes is we're giving them language that they're beginning to understand, particularly in school after about the age of 5. I am nervous, I am anxious. We have to define all those, because my idea of nervous, maybe I get butterflies in my stomach, and your idea of nervous, maybe you throw up. Okay, those are two very different things.
Sure.
And some anxiety is motivating. Sure. Other anxiety is crippling. But to be able to talk to kids and give them the language, not just to understand what we're saying, but to express how they're feeling. I always say every behavior has an ABC. an antecedent, a behavior, and then a consequence. But if we don't get to the antecedent part, we can never change the behavior part. And school often deals with the consequence. Your analogy of walking alongside the kiddo and helping them figure out what happened is beautiful, unless I've got a class of 27 6-year-olds.
Very difficult.
And you know, at that point, I may know what I want to do, but the reality is, what do I as a teacher do? I have this youngster and then 26 others. I'm also teaching them how to read. And so being able to communicate as a parent is so important, to be able to say, I think this is a struggle with my kid, because then the teacher has a heads up. Because you know, a lot of times the first 9 weeks of school are getting to know your kids in your classroom. That's a lot of learning with little people whose vocabulary hasn't caught up, nor do they have the understanding of adolescent child development as we as adults do. And so I think to give kids language to be able to communicate. Self-advocacy is my number one goal in an IEP. A child's got to be able to say either, I struggle to read, I struggle to understand, I struggle to write and communicate. But that's bold. That's very bold.
Especially for a young child.
Yes. And some kids take it overboard and they say, I can't read. And they sit and you're like, no. We're going to learn to read.
Yet. You can't read yet.
Any struggle in school doesn't have to limit you. We have technology and accommodations and modifications that we can make, that there is no issue in school that we should not be able to overcome, particularly with technology.
You know, I know it's, you know, the confidence of that child is so important, but I do think there's also a lack of confidence sometimes of the parent in the school and learning process. How do you help deal with their anxieties not being passed over?
Go see James.
Yeah, go see James. James, how would you deal with that parent who has anxieties?
Can
Go
I
ahead.
back up,
Sure.
though? What I wrote down is, what if I think my child has anxiety? So I'm listening to this program. I think my child really has a clinical issue with anxiety. Where would we tell them to go?
Well, hopefully, and Dad can speak to this as well, probably the easiest thing to do would be to ask their pediatrician for some
that's good.
assistance.
Yeah.
And there's a 7-question questionnaire that can be used. It's very simple. Most pediatricians, I would think, are going to know about it. It's called the GAD-7.
Generalized Anxiety Disorder, GAD, GAD, and 7 questions is for that.
It doesn't take much time, and that could give them an indication of whether they need to refer to a counselor or take some other step. But that's where I would start, just because most kids have access, hopefully, to a pediatrician
that's a
or a
great
family
response.
doctor.
Yeah. I just, I was thinking as you were talking about the parent out there going, oh my gosh, you just described my kid.
Yeah.
What do I do?
And there are, I mean, you know, as we all should be somewhat fearful of information from the internet.
Absolutely.
But there is some good information. The American Academy of Pediatrics has a website, aap.org, that you can go and you can ask those questions, questions, and I think you can trust some of the basics. And pediatricians are becoming more and more aware of. Pediatricians are also counselors to a certain degree, and so we can handle, like separation anxiety. I mean, Pokey, how many times at the first few weeks of kindergarten have you seen children peeled off of their parents?
Parents peeled off their children.
Yes.
Drop them off and move quick.
Just drop them and leave, people. Just drop them and leave.
Please do not walk your child into the building after the first week of school.
Trust the system. Trust the system.
So you know, pediatricians got to help with that. That's going to get better.
Yeah.
Don't look. Key is don't look back.
Right.
You know, when you drop them off, keep on walking, no matter what you hear.
Go and stay busy.
Yeah. And
what you hear.
but
Mama,
they're killing me.
they're killing me.
Bring your earplugs if you need.
That's right.
I hate this
so the
woman.
pediatricians, I think, are the great place to start.
Okay.
And look, most kids, fortunately, don't need the next step of
Absolutely.
counseling,
Yeah.
but some definitely do at kindergarten or even before. We have some great early childhood counselors that can make a world of difference.
And I'll clarify very quickly, that is not to say that if you know of a counselor in your area, you can't start there.
Sure.
But most kids are probably just going to have access to a pediatrician or a family doctor first. So.
Guys, I want to tell you about a project that we have been working on for a long time, and we are so excited that it is officially out in the world for you to get to be a part of. Yes. Shane, why don't you tell us a little bit about our newest book?
Well, it's part of a Life Along the Way series. Jesus was referred to as the Way. The first 200 years of the church is life, and so how do you walk along the way with Jesus? What we've done is taken all 4 Gospels and the first chapter of Acts. We put them into chronological order, and they've come out into 360 devotionals. And so in 4 90-day devotionals, you can walk with Jesus every day in the same pattern and same that the Bible has it. And the first one is Jesus with Us. It's the first 90 days, talks about the beginning, the prophecies of his birth and the coming of the Lord. And then it talks about his birth and several years after that, and just helps you to feel like you are at the very beginning, truly at the start of the journey of Jesus, and what a powerful impact that can make in your life.
So you and I have been doing this for a year. We've been walking through 365 days with Jesus. And I think for myself personally, what's been so impactful about reading it in chronological order and reading it slowly. We're not skipping around on what we like about what Jesus says and what he doesn't, right? We're spending time in all of his words and getting to know him as a whole person. And so I think whether our listeners are have been walking with Jesus for a long time, or maybe are just wanting to get to know Jesus, this is a great devotional for them.
C.S. Lewis says if you're going to tell the story, you need to tell the whole story, and this is the whole story.
Yeah, well, guys, I want y'all to get a copy of this book. We'll put the links in the show notes for you to be able to get a hold of it. It has been truly life-transforming for me, and I want you to be a part of it as well. Join us on the journey.
So what happens, let me take this just a little further then. What happens if your child is diagnosed with some type of anxiety or disorder or a learning situation?
I was going to say, or something like ASD, autism spectrum disorder,
exactly,
or SLD specifically.
Because that, in the examples that I get to follow with you and your advocacy, the parents really are, it is a chicken little and hold me to the pole kind of situation, because they are about to come undone. So how do you deal with that once that's happened?
That's a big question.
Well,
Yes, it is, and so I'm glad Ronnie and I can sit here and listen to you.
Well, I think first of all, you've got to find your people. And I mean, how many marriages do we know have come apart over the learning of a child?
Absolutely.
Yes.
I tell parents all the time, do not sacrifice your relationship with your child on the altar of the school. Because sometimes the school's expectations are incongruent with your expectations, and you have to say, yeah, this is not going to work, and that's okay. What I see more often is parents just feel alone. And if you can reach out to anyone in the community, I mean, ask the school. PTO, PTA is sometimes a place, I hate to say it, but social media is sometimes a place where like-minded parents can get together and begin to feel support. We do a good job of this really with the Down syndrome community. Parents begin to reach out to one another, and not that their walks are all the same, but there are enough similarities.
Let me get you to bring some clarity to something, because I just had this scene of a 9-year-old who's accidentally listening to this going, Mama, this Miss Dr. Pokey person just told me if it's not working out with school, I can just give up. I can just quit. That's okay to just let it quit. Yeah, help me here, Mom. What would you say at that point?
Okay, well, we all have to go to school.
Yeah, okay. Start at the beginning.
So we all have to go to school, yes. According to the state, we all have to go to school for a certain amount of time. And that's why communication is so important, to figure out what is the teacher's preference of communication, and to begin lay common goals on the table. You know, it may not be a 4.0. It may be that this year my child learns how to, come to school, sit in their chair, and answer questions orally. I mean, because some kids that have processing struggles hear the question. We're having a discussion about history, and we're talking about Washington, D.C., and George Washington, and he was the first president of the United States. and I'm trying really hard to listen, and I hear who was the first president of the United States, and the rest of the class, I'm going on who, okay, that means it's a person, was, okay, that means not like now, the first, okay, that was like the one at the beginning, the president. I know who that is. And the question the teacher really asked is, and where did George Washington live? And what's my response?
George
Washington. Yes.
Because in my mind, and then the teacher says what? You are not going to be that class clown. Get up and leave my class, which would kind of be an answer to prayer because most kids just want to escape.
See, and right there, he's taught to hate conjunctions right there, because there's a second part to that.
And George Washington.
And George Washington.
Possibly the teacher.
Yes.
And possibly the teacher, yes.
And everything there is about learning at
right.
that point. When what did he? And he literally is looking at you like,
I'm trying.
What?
Yeah.
You asked me who the first president was, and if the teacher confronts it right there and gets in a power struggle, you can watch it unfold when realizing there's a simple tool. The teacher communicates with the kid, it communicates with the parent. When I ask James a question, I will walk over to his desk and put my hand on his desk and say, where did the first president live? Where did the first president live? And make eye contact, go on with the rest of the discussion, and then come back and say, remind me again, where did the first president live?
James has a look on his face right now. Like, oh, I know this one. I know this one. I know this one.
Oh yeah, that's right. That's right.
So maybe we should have talked about this beforehand.
I knew that. It was the anxiety of the situation.
And okay, not to put you on the spot, but how old are you?
40.
Okay, and how much education do you have?
A fair bit.
A fair bit.
Fair lot
Yet
of it.
I made you anxious in a situation. and
On
you're
TV. I'm kidding.
on film. You're a well-educated adult.
Sure.
So if in a friendly relationship I can amp up that kind of anxiety, then what about a 7-year-old sitting amongst his peers with another adult?
Oh, gosh, it makes the anxiety go up in me.
I know, and so it really those are the situations that make me as a teacher go, wait. I'm supposed to provide a risk-free learning environment, not a threatening learning environment.
We'll go back, because it brings me to a second question, and that is, how fundamental or important is it for the parent to be able to communicate with the teacher and go, I know you've got to test them, and those tests are going to have an impact on your role, but right now I'm looking for little Johnny just to be able to raise his hand and answer a question this year. I mean, there has to be some communication there.
Yeah, absolutely. Communication.
Yeah.
I would tell my teachers, student teachers, those that are in classes, I would say, you need to know your kids, and when you get through, know your kids. Knowing your students and those students feeling known is, to me, the most important part of teaching. And I think we can get lost in that as teachers, and I can give you 120 different ways that we beat that dead horse and we continue to pile stuff on teachers. But to appreciate a teacher and what all he or she goes through during a day through communication is as important as communicating about your child. Because when I feel appreciated as a teacher, I want to take care of these little people that I'm responsible for. So back to your question, what do? You got to find somebody who shares like circumstances. But I mean, isn't community a key part of all of us trying to succeed in this thing called life? And then we've got to find tools to communicate, and then tools to work within the confines. Teachers are going to ask questions and kids are going to get called on. Okay, so what kind of strategy can we use? What can we do? Chances are there's not just your child that needs it. There's probably 5 others in the room who also need. The other thing teachers can do is give a list of questions that are going to be answered during a discussion or lecture, and make sure that you've answered them all. And then you start looking at kids' desks, and those that have those questions answered, you call on them. There's a reason the same kid shot his hand up every day in school.
You pointing to anybody?
Wow. That's not supposed to be a bad thing.
No, but it's not. Why did your hand shoot up?
Because I knew the answer.
Because you knew the answer.
Right.
And that's why. And so teachers who will say, no, don't answer that question again. It's like, wait a minute. What? So then put everybody's names on popsicle sticks and draw popsicle sticks. But when somebody answers wrong, don't criticize, teach.
So don't go Mount Vernon. Oh my God. How old are you? How much education have you had?
I could not have planned that any better.
So,
Please no, I don't care what you know about American history.
Yeah, it's not my strength.
so in this world that is
Thank you,
so
James.
many of these people will be in worlds dominated by standardized testing.
Oh.
Is standardized testing anxiety real?
As real as this pencil.
And what do you do about that in that circumstance?
I'll just throw out there before she lets us know everything else that I think it's anxiety provoking, not just for the kids, but I don't think there's anything that happens in a school administration, the whole system, that creates as much tension and anxiety as standardized testing.
Amen.
Teachers,
Oh.
administrators, glory.
And it all rolls down to the baby sitting in the chair.
Exactly.
I do not think, I mean, it's kind of like one illustration I read was that somebody lost their keys at night, and somebody said, why are you looking here on the, right here? Because that's where the light is. It's not where I lost my keys, it's just where the light
Where
is.
the light
And I
is.
think the standardized testing gives you something you can say that you did to try to monitor a child's progress. When, as Pokey was saying, it's knowing that child and where they started and are they making progress. Some are going to progress a lot faster than others, especially in the early years, but even as they get older. And what you tend to see, unfortunately, you know, I know in the statistics for the state of Mississippi, but I think they're pretty nationwide, is about 8th or 9th grade school attendance starts falling off. And the reason is because the readers then, when you, and about 1 out of 4 children struggle with reading in the classroom, if not more.
Wow.
Yeah.
And so if you,
Equally, that number or more needs significant mental and behavioral health.
exactly, so you're talking, you know, you're talking really a crisis in that classroom, and for the teachers that are equipped for that, and see, that's a lot of the issue is I don't think teachers feel equipped to deal with reading problems, certainly not mental health issues. And so I think the more parents can understand that, and it's not about their child, it is about their child from their perspective. It's not so much the teacher's concerned about the child, but they're trying to teach that whole class.
Absolutely.
So I think we have to have community. We have to
Let me ask you
have
this. Do we
conversation.
take a dentist and do we measure his effectiveness on how many cavities patients have as they come in his office?
No. It's silly, isn't it?
That's ridiculous.
I'd put so many dentists out of work. It'd be my data.
We do that to teachers all the time.
That's it.
Wow.
We're going to, you know, and heaven forbid we feed the pig. We just keep weighing it, keep weighing it,
Yeah.
keep weighing it.
This is a great conversation, but I do in our last few minutes want to get to this, and that
Anxiety?
is, well, to the child that does need a 504, and what is that, or an IEP,
So
and
a
what is
parent
that?
or a parent or a teacher can always request an assessment. A lot of parents don't know that.
Well, the misconception is, or it used to be, I'm out of it a little bit, is that the child had to fail for 2 years to
Yeah,
get that
that's
assessment.
not anymore.
And it never was.
No.
The school has to evaluate after 2 years, but you can request an evaluation at any time.
point.
And the school can do that.
Well, and just to clarify, it's for the child who really may need help in school, has a diagnosis, or even maybe doesn't have a diagnosis yet. There's something called the IDEA, Individuals Disabilities Education Act, and basically there's 13, 14 diagnoses on there that are federally recognized, and if your child has that diagnosis, they are awarded accommodations. And the whole goal is just that they receive an equal and fair education. It's not, people think accommodations are maybe excessive or you're giving this child extra. No, it's really just to try to get them up to where everyone else is.
Can I give an example of accommodation?
Yes.
Take off your glasses.
Oh gosh.
Now, I'd like for you to.
Can't read that.
Okay, exactly. So, do your glasses make it unfair for us to sit here and have a discussion, or do your glasses make it an even playing field so you can see everyone around the table?
I think it's a little more fair to let me see.
But I mean that is an accommodation.
Right.
You know, but teachers feel like, well, if everybody had to do 20, but this child only had to do 10, that's not fair. Well, if they can show proficiency in 10, quite honestly, nobody should do more than 10. But if it's about fatigue, then 10 it is. Whatever's established in that document, that is a legally binding document. That's what has to happen.
So you're talking about the 504 and the
And
IEP.
IEP, those
So
are both. There's a misnomer there.
Yeah.
That a 504, 504's got a different different teeth if you want to bring about due process hearing, but they both can bring about due process hearings,
Okay.
which is if something's not being implemented.
Okay.
What I was going to say, though, so many times I go into a meeting with a parent and I'm just there to be their cheerleader. Sometimes I don't say a word, but you walk in as a parent and you've got 5 or 6 people sitting on the other side of the table, and typically on the other side of the table, which is so comforting for us to sit across from one another. And at the end of the day, it's one more meeting to get off the docket. So we sign this paperwork and move on, sign this paperwork and move on.
Very intimidating for a parent.
Yes, yes. And a parent can say, hey, I want to take this home and think about it, and I'll get it back to you. The parent doesn't have to sign anything other than the fact that they were present. You do not have to agree to anything.
Well, the other thing I would tell parents is that with advice and stuff, having 1 or 2 ideas that you think, accommodations that you think would help your child.
Yeah.
And at the end of the meeting, have it written down, and you, at the end of the meeting, if they say, well, we're not going to be able to do that, you say, the school says they will not be able to accommodate as mentioned above. Turn it around and say, would you sign
Absolutely.
that?
Wow, that's good.
And because the documentation, it's like James says, this is a federal mandate.
Yeah, this is not if I feel like it or if we have funding for it.
And if they know that if the federal people get involved, there may be some reason for them not to be funded as well as they
Well,
would.
and can I?
No district wants to give up their federal funding.
No, and in defense of the school too, and I try to always help parents with this because they are completely overwhelmed with needs for the most part.
Yes.
And they got into what they're doing because they want to help kids.
Sure.
It's hard to sit across from a parent who really needs you and not maybe know the answer or not have exactly what they need right then. It could be a funding issue. And so just in defense of what they're doing, but I think if you can be assertive as a parent, if you can be collected and try to be educated and persistent, you know, I think the squeaky wheel gets the lid.
Yep.
Every time.
So, but just to let them know that those educators are also in a very challenging situation, and it's a lot of times why a parent might leave feeling a bit bullied by them, but it's also why they feel the need that I can't accommodate every kid that may need it.
And that it is a team approach.
It
I want
is.
you to
That's
tell
why
me
there's
what
all those
I can
people
do.
there.
I want you to tell me what I can do.
Yeah.
From on my side to help you do what you do on your side, and I want you to do on your side will help me do on my side. So it's not like I'm trying to get you to educate my child. I want us to educate my child. But before it's over, I have a little hope story.
But go right ahead because we're getting to the end.
Well, it's so cool because being old,
yeah.
you have a lot of experience. And I was at a particular store, and I always like this because the person behind the counter, as I'm standing there, they're checking this person out. This was at a feed store, and so I'm standing there, and she kind of tilts her head and looks, and I can tell she's thinking, is that? She said, "Are you Dr. Ken?" I said, "Well, I used to be." And I said, "I'm retired now." And she said, "You saw my child, you know, when he was 10 years old." You said, "You use those words that no parent likes to say. Y'all diagnosed my child with autism." And I thought life was over. And you told me, let us work with him. We'll find the key that unlocks the treasure chest. And said, when we find the key, you're going to be amazed at what's inside of him. She said, he is now an electrician, making a great living, went 2 years to junior college, was trained. We found what his passion was. We allowed him to move toward that passion. And she said, he has a great family and a great education and a great life. Wow. So I would just encourage parents, what they are then seems so unconquerable almost.
Agreed.
But if you will keep your head down, be persistent,
and seek the help
walking
you need.
alongside them,
Keep asking. If your pediatrician doesn't provide you what you need,
keep going.
Find somebody else. Find somebody. That to me is the number one piece to the puzzle is finding the support that you need.
Right.
Because whether it's with anxiety or a, learning disability, ASD, whatever it is, it's finding that support system, because it's the support that will lower our anxiety as parents that will allow us to help our anxious child.
Well, I have the privilege of marrying my junior high principal's granddaughter. Okay. And the first time I ever met him, I said, well, you may have talked to my mother. And he went, oh, yes, I know your mother very well. Because being a hemophiliac, there were all these conversations about rules and things that should and should not happen. But to have a mom who was, whether I always liked her or not, she was always on my side. And she was an advocate, and it matters. And I've watched Pokey do that so many times.
Let me say this, too, to any parents out there, do not ever, ever, ever apologize for being your child's advocate.
No.
Under any circumstance. Never, ever apologize. That's why God gave you that child. Be their advocate.
And try to do it, this is almost impossible, but try to do it unemotionally. Try to keep your emotions at home as much as you'd like to. If you have to pinch yourself under the table or whatever, try, because emotions usually cause more harm than good. And so if you can go in, and plus, lack of emotion sometimes causes people to be a little more intimidated from you, because you got your act together. You're just not up there as one of those other emotional moms or dads. And dads, please get involved.
Yes, I was just going to say, when dad shows up, the meeting goes different.
But the dads need to. I've had plenty of couples come in, dad said, well, I don't see that problem. I said, how many times do you talk to the school? Do you take the call from the school? Do you get involved with homework? Yeah, that sort of thing. Well, not. I said, okay, Mom, for the next week, let him do all of it. They're usually back in my office in a week. Saying, okay.
Another tip that I learned from a parent who had a child who had lots of issues is IEP meetings would be like 4 or 5 hours long, because that's how long it took to break down all the services the child needs. The mom always showed up with an ice chest full of waters and cold Cokes, made some Rice Krispie treats, put it in the middle of the table, and the total atmospure in the room changed.
Yeah.
And so, I mean, not that
It'd
you
change if somebody did that right now. So.
Snacks.
Yeah.
Snacks work. Snacks motivate.
Well, this has been a great conversation, and I've heard it talked about from different angles between these two especially, and then adding James onto it for a long time. But it always amazes me, because I've known so many people as a pastor who this is really the issue in their life, is their child's learning ability. And school can become a great thing, and it can become an absolute terrifying thing for people. I do want to offer this. If you're listening to the podcast and you'd like more information about helping your child through learning anxiety, if you'll send that to annl at moorewestcenter.org. She will get that to both Pokey and to Ronnie and to James, and maybe between the three of them they can come up with some answer to help you in terms of your direction. But we want to be a help for you in that. So again, thank you guys. This has been wonderful.
Thanks, enjoyed it.
Thank you.